GSM, Genitourinary Syndrome of Menopause. I thought vaginal dryness was just something I had to live with after menopause. Nobody told me that there was a name for it, let alone that there were options to help. I hear this constantly, and every time I hear it, I think the same thing. This woman has been suffering quietly and unnecessarily. Many women are dealing with symptoms they were never warned about, and they do not realize these symptoms are connected to menopause at all. A lot of women assume things like vaginal dryness, bladder changes, discomfort with intimacy, or recurring urinary symptoms are simply part of aging, something they just are expected to tolerate quietly. But there is actually a medical term for this group of symptoms. It is called GSM, Genitourinary Syndrome of Menopause, and it is incredibly common. GSM happens because estrogen levels naturally decline after menopause, and the tissues of the vagina, the vulva, and the urinary tract are very sensitive to that hormonal change. Over time, the tissue can become thinner, drier, less elastic, and more irritated. The natural pH changes, even blood flow decreases down there, and women may begin noticing symptoms like, persistent vaginal dryness, burning or irritation, pain or discomfort with intimacy, recurrent urinary tract infection, urinary urgency, bladder leakage, or just feeling like things are not the same down there like they used to be. And one of the biggest problems is that many women never connect these symptoms to menopause at all. They think, oh, I'm just getting older, or worse, they feel embarrassed to bring it up. So first, I want women to understand this. You're not imagining it. You're not alone. These are real physiological changes that happen to many women after menopause. Okay, now, once you've learned that there's actually a term for these symptoms, the next question is, okay, so what to be done about it? And the answer is there are options. For some women, vaginal moisturizer and lubricants may improve symptoms. For others, healthcare providers may discuss prescription treatment options, including localized therapies that work primarily in the vaginal tissue itself. And for some women, non-hormonal prescriptions may be considered. The important thing is that women know they have options, because too many women are silently suffering with symptoms they thought they just had to accept. And I want women to hear this part. You do not have to wait until your symptoms become severe before you have a conversation. You do not have to wait until intimacy is painful, or until you are getting, recurrent infections, or until your bladder symptoms are affecting your daily life. You're allowed to bring this early. You're allowed to ask questions. Is this related to my menopause at all? And you are allowed to want comfort, intimacy, and quality of life, even after menopause. Now, every woman's medical history is different. And so in this video, I'm just bringing awareness. This is not an individualized medical advice. But if you have been experiencing dryness, irritation, pain, symptoms, recurring infections after menopause, these are absolutely symptoms worth discussing with your doctor, your healthcare provider. Because sometimes women feel relieved from simply hearing there's actually a reason this is happening. And sometimes just having language for what you are experiencing changes everything. Follow along for more honest conversations about menopause and midlife health.